So, so Dimitri, as I was telling Dave right before you got here, is so this week's the hinge. I think I emailed you guys back about that, and I used the word hinge instead of deadlift just because the deadlift gets a bad rap for hurting people's backs. But truthfully, I've used the hinge a lot to actually help people get their back stronger and actually diminish back pain. So, just food for thought on that. But just as we work through this, the hinge. Fun fact, biomechanically, it's the strongest movement that we can do as human beings. It's picking something up off the floor with good form, of course. And that has to do with the amount of hip flexion. So that's huge because what makes the hinge a hinge as opposed to a squat, let me move the video out here for a second. If you guys can see right here, now this individual, you see the biomechanics. What makes it a hinge is that this angle of the hip flexion is much greater than knee flexion. And what this allows for is maximum actin myosin cross bridge overlap so that we get the most pull out of our glutes and hamstrings, which are the biggest muscles in the body, hence why it's the strongest movement we can do. One note of caution though, as you know, you can't really heavy deadlift more than about once a week. Bad for the back, and one thing too, because there's such a high level of force output, central nervous system activation just gets destroyed in a good way, right? So we can create super compensation for the nervous system with, you know, loading heavy deadlifts, which is from a strength aspect that's usually beneficial, but also from an endocrine response aspect. But we got to be careful because we load it heavy more than one time a week, we can burn ourselves or our clients out really quickly. That being said, if you look at the bottom bullet of the slide, we can go to single variations very frequently just because that load isn't as maximal on the entire body. But asymmetrical loading is always a huge benefit, not just for athletes, but for the regular individual, because one, it helps us defeat asymmetries. So if somebody's stronger on one side of the body than the other, either due to injury or posture or just chronic movement habits, but on top of that, we are also able to create a higher amount of force output due to bilateral deficit. When you can get people on the one leg, do it with the hinge. You can do single leg hinge variations multiple times in a week. And if you're doing a heavy dead, definitely try to either go a lighter dead, but you can also then just go to a single leg dead and still work that pattern pretty heavy too on another training day for the week. I go in here. All right, so who should be able to hinge? Honestly, you know, everyone should. It's our primary movement pattern for picking something up off the floor. So when I work with an individual who is usually saying that, deadlifting is bad for your back, I'm like, well, then you're saying picking anything up off the floor is bad for your back. And so there's usually some education there. But, you know, we just talked about it's our strongest movement patterns, how we pick things off the ground. And I said this in the very beginning. There's research, actual clinical research in multiple journals, as well as I've seen it firsthand. But yeah, teaching somebody to hinge properly and get stronger at picking things up off the floor actually helps diminish back pain. Again, as coaches and trainers, we are not necessarily tasked with getting rid of people's pain. However, we can help them get stronger. Again, we're coaches, we're trainers. As a strength coach, we can get people strong. That is our job. And if you get somebody's back strong in the proper way, the pain magically goes away. So we can help folks with that. That being said, we're not necessarily going to all deadlift the same way. So one, we got to figure that out when we're training with individuals or training ourselves. And another thing is huge too, is people forget, quote unquote, how to hinge because of this gentleman, like in the picture on the right. We spend so much time in flexion, in spinal flexion. Bracing, neutral, or even spinal extension is extremely hard for people to do due to a tissue quality issue, adaptation, both soft tissue and neurological. And speaking of neurological, there's a motor patterning issue too, so we'll cover that. All right, so what do we need if we're going to have somebody deadlift or hinge? We got to make sure that they're able. So when we come through and we look and we assess somebody for any kind of deadlift pattern, we want to look at hamstring mobility. low back stability, so can they guard the low back safely, hip mobility, so can they move through the hip joint correctly, and then shoulder stability factors into that a little bit as well. So when we're looking at assessments for the hinge, there's numerous amounts of screens. These are the ones that I've used. The therapists and the coaches that I work with, we use these. They can be implemented almost anywhere, and they do give you a pretty good full picture view of what you're dealing with as far as somebody's ability to pick things up off the floor. The first one is the active straight leg raise. That's from the FMS. So that just checks anterior line bracing sequences as well as posterior line flexibility. So if somebody can't get into that flexion position laying on the floor, you can't expect them to necessarily do it safe, like a full hinge, like a full 90 degrees of flexion at the hip or more, picking something off the floor without hurting themselves. Obviously, people can pick stuff up off the floor even with bad form. However, if you're going to start loading that pattern, you want to make sure that that tissue quality is there in the posterior chain and that they have the ability to brace in the front line or in the hip flexors. When we go to look at hip mobility, we are looking at range of motion internally and externally. So we covered this a few weeks ago now on assessments, but this just looks at hip internal range of motion. So when somebody is going internal, but you're looking at about 20 to 30 degrees of internal rotation here. In an external rotation, that leg should be able to swing out about, switch that. That leg should be able to swing out about 30 degrees, and then internally you're looking at about 45. So again, it's about 70 total degrees range of motion in this arc in the hip. And then the last clearance test is this terminal knee extension. So this gentleman, you do this laying down, but in a supine position with the foot flat or the leg flat, we should have greater than 180 degrees of knee extension. And so that just tests, one, if there's any tension right here in kind of the lower quadrant of the posterior chain. So somebody should be able to lay flat on the floor like this and flex their knee and actually be able to raise their heel off the ground. So those are flexibility tests. These here are stability tests. So this is looking if somebody has the ability to brace into a neutral spine and neutral hip and be able to pick something up off the floor without compensating. So this is different. This is one, if somebody's working on mobility issues, you can go through here, you can check these. You can use some of the simpler regressions of the hinge, which we'll go over in a minute. But if they're tight, you wouldn't necessarily start hammering these. Or you would actually start using some of these as interventions to help individuals get stability in places where they need to so that they don't compensate like through their back or through knee valgus when they're deadlifting. So the first one's a plank hold. Plank hold just checks if somebody can keep a neutral spine based off the anterior line. So really what we're looking at there is the musculature of the abdomen. So transverse abdominis, rectus abdominis, internal, external obliques, and even the hip flexors. On the opposite side, we're looking at if somebody has the ability to hold a neutral spine in extension. So in this position here, reverse plank on the elbows or the hands, so an individual is trying to hold terminal hip extension with a neutral spine. So in that position, what you'll see is people will try to drop their back down, which means that the musculature in the glute and the low back, the erectors of the spine, don't have the tissue tolerance to hold a neutral spine. So not necessarily you can't pick somebody up, you can't deadlift somebody if like they can't pass this test or this test. It just means you can't load them heavy yet, right? So if somebody's struggling with these interventions, at this point, you can deadlift them, right? If they pass the mobility test from the first slide. But if you get here and they can't have a proper bracing sequence, you're not going to want to load them heavy because they can hurt themselves because they don't know what muscles to squeeze without, or for picking something up off the ground and could hurt themselves. And then the last two things we look at is the single leg stance here. Single leg stance or a single leg RDL, essentially hold. And all of these are for at least 45 seconds, by the way, except this one.
Oh.
These are 45 seconds of stability holds. Right there, that's just checking unilaterally. So we were talking about asymmetries. If somebody has the ability to actually hold in that lengthened position, right, in this posterior chain here, with one leg kind of up in the air. And so are the adductors and the abductor complexes, can those stabilize the pelvis in a neutral position, as well as can we hold our back in neutral while we are loading the hip flexors and the back extensors, hip extensors at length? Can we hold that position one side at a time to make sure that people aren't compensating? So these three are all for 45 seconds. This one here, that's just a regular side plank. That one's only 15 for the abductor complex, which just shows that we have enough glute function to make sure that our pelvis stays neutral when we pick things up off the floor. That's only 15 seconds. That's a very small muscle group, but it's still one that we kind of want to look at. These three are the important ones. People will sometimes struggle with that, so that's why it's only 15 seconds. But the other three are 45. So when we are starting to work training somebody to deadlift, to hinge, we always want to look at where their setup position is first. So again, this is assuming somebody's passed the clearance test, they've passed the mobility tests, the ideal hip hinge position. So these are three different deadlift positions, and not necessarily any of them are incorrect. What we actually look at when we are working with somebody who is trying to deadlift, it's to maximize the pull from the hip. Excuse me. Like we talked about, the goal here is to make sure that we can get the maximum amount of force from the posterior chain with the neutral spine and picking up the legs. How we do that is our hamstrings are as parallel as possible to the floor. So with that being said, it's not necessarily going to be the same. So this individual's truly parallel to the floor. He's almost in a squat. This individual's hips are a little high. This is really extremely high. So all three of these are deadlifts. However, based on the individual's limb length, so like if you have a really long femur and a really short torso, or a really long torso and a short femur, you're going to be in this position. If you have a short torso and a really long femur, you're going to be in this position. And that's because those moment angles or those moment arms are starting to push the angle that we're lifting with away from where the center of mass is. So we got to keep this center of mass right over our feet and in line with the bar. So if somebody's got longer legs, they're going to have to get their butt up further in the air so they can keep that over their center of gravity and maximize the pull. So that being said, this is why some individuals, like somebody who sumo squats or sumo deadlifts, I'll have somebody who's this is their primary pickup pattern. If they're picking up for weight, I'll have them sumo deadlift for weight, for like maximum force output. Now, if I'm going to hinge, I'm still going to have people work all three of these patterns because it's just picking something up off the floor. However, if somebody's trying to go for true absolute weight, that's going to where somebody's hamstrings parallel to the floor at, staying chest over the bar, center of gravity over the bar, or shoulders over the bar, and getting the greatest amount of hip flexions or what we look at. Right. So somebody's super tall, with a longer legs, somebody with longer legs, like a tall to maybe like a shorter torso, like a ratio of femur to torso. Somebody like that may have to set up in a different deadlift position than a traditional deadlift. That's all that means. So all you're really looking for is hamstrings can be as parallel to the floor as possible based off whatever variation of the deadlift you have to pick or the hinge, greatest amount of hip flexion that we can achieve, and then the shoulders are over the bar. So one other thing too, when we're setting up the bar, we always tell people to pull the bar into, their shins, or pull the bar into themselves. And that just has to do, again, with keeping the bar over the center of gravity, which is about they say that's the fourth metatarsal, which is right around where the edge of your shoelaces are. That's where the bar is. So that's the ideal hinge position. We can bridge, we can press to train hip flexion, and then motor patterning is a huge one. We're starting to get people to start hinging. So these are the three things. Once we kind of find their setup position, if they're cleared, we bridge them, meaning from the floor, then we press them, and then we start doing motor patterning if they are unfamiliar or inept at doing a true hinge pattern. So yeah, here. Tight hamstrings, the hamstring siphon fascial release. I don't know. There we go. So this is just one. It's just these are just different hamstring exercises that we can do for mobility issues. I don't necessarily, this is an end all be all, but this is just showing you kind of the basics. There's a 2-minute one. I might change these up when I send them to you guys. Oh, so softballs under the guy's leg. This is like an active release on the hamstring. So see it? See if I can do it again. So see how he's kind of extending and flexing the leg? and then redistributing the ball in different positions in his hamstring. So if somebody has trouble with the active straight leg raise, this is a good intervention. Apologize for the slow internet. Everyone's on it right now because everyone's working from home. Once we get there, we can actually start achieving range of motion. I'm a huge proponent of proprioceptive neuromuscular facilitation stretching. So kind of contract, relax stretching. 2 and 1.
What a commercial.
I don't even pay attention to it anymore. They're just all over the place. Let's see. Yeah, so I have a new series of these that I just put up for my clients. I'll put these on so it's a little straightforward for you guys. He's just doing a demo. Okay, here we go. So band comes over the foot, and then we create a stretch and then a contract by extending down. And then we stretch, and then we create contraction by pushing down the band. Does that make sense? So it's contract, and then there's that quick moment of relaxation that allows us to get deeper into a range of motion. So that would be the 2 stretches for the hamstrings. So that's for tight hamstrings. Back stability, side plank we covered, clamshell, just real quick. So sideline clamshell, this is for external rotation, or glute activation, creating extra rotation of the hip. So this is just straight old school, body by Fonda kind of thing. I usually have people do that with bands too. So that's just another hip stability or a back stability exercise. And then hip mobility exercises, I'll cover those next, but internal external rotation drills, foam rolling of the hip flexors, of the glutes, and the adductors are a huge help with that. Once we're starting to work through the hinge, so once we've started to get everybody's stability and their mobility back, and we've kind of figured out where they can start pulling from, then we start going through these different this is honestly just motor control drills. So this is to teach somebody how to hinge. So the first one is we take the kettlebell, we rear load it because it's close to the center of gravity. It also forces the shoulders to be packed and the lats engaged. So that's why this kettlebell is back here. And then see how he's still hinging? It's just from the knees. So that's a deadlift. So this gentleman's still deadlifting, but see how he's put the weight back here, so he's not loading his spine. And it also forces the shoulders to retract, and it holds that packed position that we want somebody to do when they're deadlifting. From there, we slowly start to move them up. So then we go to a half kneeling variation. So at this point, we start to put one leg up, one leg down. And so this is where we see if somebody's ability to actually hinge on one side compared to the other is equal. So same thing. It's still a hinge. So now what we're looking at is see if in the front leg though, how that's almost like that full deadlift position. I mean, he's in a squat because the knee's bent, but see how he's kind of getting deeper in hip flexion on the right side. So now here, we're starting to mimic more of a deadlift because one foot's up. And then from there, so we've gone from both knees, one knee, then that's when we start loading it on the feet. When we're on the feet, this is where we start to see if somebody can truly get into a hinge from a motor control aspect. So these are folks who literally, they've never had the ability to brace their spine and have to hinge. Now, some of the key points when you're cueing this, hold the shoulders back and then try to sit your butt back and push the kettlebell backwards. Because I've seen people that do this and they still just cave forward with their spine. So the shoulders have to stay tight and then they have to really work. Butt comes back, slight knee bend, and then real hard bend through the hips to push the kettlebell backwards, back behind the heels. And the last one from a motor control standpoint, from a perspective, is the stick hinge. So stick hinge is great because one, we start to align the C-spine, cervical spine, thoracic spine, and lumbar spine all in neutral here. So this gives them an external focus of attention so that they start to figure out what it's like to hinge right here. So they've gotten the idea of how it is to hinge through their hips with a weight holding them back. Then we give them the stick to kind of give them that sensation of, oh, like without load, this is what a true hinge feels like. And again, that's more of a motor control kind of progression to help individuals kind of feel or learn what it's like to get back into a hinging pattern. We covered this. This is going to be the same. I don't know if I'm going to cover this again, but when I load people, I start with a 3-second eccentric load. So that's slow on the negative, Then we'll work through a pause variation at the bottom of the motion. So with a deadlift, it's when we first pick it up off the floor. So as opposed to squat, we're gonna have to pick up the weight and sit down and pause. With the deadlift, we pause as soon as we pick it up off the floor. Or if we pick it up and then lower it to the floor, we hold that position. And then we start working concentrically so that we can actually, teach that individual to pick things up. From here, we can start to work their actual strength. So even people that do deadlift well, I still work the hinge pattern or the bridge pattern, just because slightly different force vector. So that was really quick. So the maximum amount of contraction in a bridge or a hip press, which is the next one, is here at terminal end range of motion, as opposed to a deadlift, right? If we're looking at the biomechanics and where the force vectors are, the deadlift is going to load the most amount of force from the beginning of the lift, right? That's when we first pick it up from the floor. The gravity is coming straight down. That's where we are having that greatest amount of overlap with the actin myosin chains in the glutes and in the hamstrings. Here, because he's finally up at the end and we are now pushing through a horizontal vector as gravity is still vertical, but we've changed our orientation. The maximum amount of contractions happening at the top end range of motion as opposed to like a traditional deadlift. So that's why it's a good reason, even if like you or people you work with like deadlifting, throwing in hip bridge variations are great because they really increase strength at the end of range of motion of a hinge, right? Hip press, the same idea, except what's cool with the hip press, now we are able to elevate the back and we just get through a deeper range of motion. So as you can see, still at the top, greatest amount of contraction, but now at the bottom, he's getting deeper into that range of motion from his hip flexion. So it just allows us to work more muscle through that range of motion in that horizontal force vector. The landmine deadlift, I loved this. Demetrius, we talked about this with the squat. We take away some of the degrees of freedom because we do not force the individual to fight the anterior and posterior stability, because the barbell anchored into the floor over here does that for us. All the individual that's picking up landmine has to focus on is making sure that in the sagittal plane, left and right deviation, they are, in the frontal plane, they are being able to control stability, so right and left. That way somebody can sit hard into the front of this as they pick it up, really brace the anterior chain, hold a good position, and then start to work that hinge once they've got the motor pattern down. Kettlebell, I don't think I'm gonna do all of these, but kettlebell deadlift. I like the kettlebell deadlift because it's more of a sumo. It puts the weight right in the middle of our base of support, which is easy to control. And it's usually, so we can use lighter weights right here. It's a lot easier to hold and brace a position where the hands are in between our knees as opposed to outside. So a lot of folks that I work with when I'm teaching them prefer the kettlebell when they're starting to hinge. Dumbbell's slightly different because with a dumbbell, now we have to work with both of the weights on the outside of our base of support. I'm sorry, outside wider than our base of support. See if they get a good video of this individual. So you guys see that he's got one dumbbell now. It's more to the outside and the other one on the other side. I wouldn't say this is probably the best dumbbell deadlift I've ever seen, but I just kind of want to show you. So you guys see that how the weights are now kind of on the outside of his feet as opposed to in between the legs. That just makes it tougher to control from a motor control standpoint. So we just slowly advance the lift. Trap bar. Trap bar I'm a huge fan of. It allows us to put the bar right in line with our shin, right in line with the ankle here, and keep it right in line with the base of support. With a barbell, if somebody lacks mobility, it's extremely hard to get into this position. So I like the hex because we can load the person right in the middle. There we go. It's a lot easier to control. It's a lot easier to keep the lats engaged and packed. It's a lot easier to keep the center of mass of the bar equal with the center of mass of our body. And I don't know if I've met anybody that can normal deadlift more than the hex bar deadlift. Maybe the same, but not more. And then the last one is a barbell. I will just go over it real quick. I don't even think I put a link on there, but yeah, I'm pretty sure you're both familiar with the barbell deadlift. And then here's our note on single leg patterns. Always train. So what I said with the benefit of a single leg variation, we get we get to work into bilateral deficit, which allows for more force production. It's more functional. So for athletes, it translates more to the field, to the court, when athletes are more on one leg and running and cutting and changing direction. Another thing too is, since we're having less load, there's less spinal loading, so there's less injury risk. And then this last note, single leg variations can also be used for corrective work or for movement prep, or to cycle your deadlift days, so you're not having to do a bilateral deadlift or hinge pattern every day you come into the gym. And then these are single leg variations, just to end this off. The single leg bridge, I think we'll have time to go through these real quick. So yeah, on a deadlift day, great posterior chain activation drill, because one thing is that we get from this that we don't get from a double leg pattern, is we get that adductor complex firing, because trying to stop rotation of the hips works through the center line of our leg musculature, and those adductors really start kicking in a single leg pattern, which is great for pelvic bracing when we are picking stuff off the floor with 2 feet. The double leg bridge, same thing. Where we are now just elevated the back, we're just getting through a bigger range of motion. This is a great pattern to load. You either put dumbbells or kettlebells right here on the hips, and then somebody can come up and down. So especially for athletic development, in that single leg position, which mimics reciprocal foot striking, like if we're running, we can max the amount of horizontal force on a single leg, which is hard to do with a lot of other variations in the gym, which is huge. Almost done here. Single leg landmine. Once somebody's good enough to stand up on a foot, on one leg, I move them to the landmine for the same reason we do the landmine on 2 legs. And that is because now on the left here, we are creating stability through the hip, so they can start to work a single leg pattern with a brace position. We also can brace this side a lot easier than if we're holding just a free weight. So we can create lat engagement and posterior, upper quadrant posterior chain engagement, so that we can feed into a neutral spine and hinge from the outside leg. And then the last one's here, single arm. Oh, this is a single leg RDL. So this one is literally, I think it's 2 weights. That balance from one side and the other makes it easy to balance. So right and left side. So there's a weight in each hand. Not to rush through these, just want to make sure we get it all in before we get cut off. This one's functional because now, since we are loading one arm in the single leg RDL pattern, or the single leg deadlift pattern, we are also now working through the transverse plane, if that makes sense. Because we have one side, so we go from there. As soon as this individual leans forward, he is now fighting the urge to rotate his shoulders, which then gets us work through the transverse plane, an anti-rotation exercise, and also an anti-lateral flexion exercise as he stands up, because he's only loading a dumbbell in one hand. And then finally, this is like for a hinge pattern. I honestly think the single leg bridge I like more. It's a little safer to set up, but the single leg deadlift pattern is extremely hard to do, but a massive amount of load that we can put on one leg. I honestly load individuals as heavy as possible on a single leg deadlift variation with dumbbells, because the dumbbells can sit more on the outside and stay more in line with our base of support. However, from just like an athletic development, stability, mobility perspective, that's a good exercise to do as well. But somebody definitely needs to pass that active straight leg exercise before they do this exercise. But you can obviously load a lot of weight on that since it's a barbell. And it's kind of like you do the assessments first, clear those, so you can find out where they should start with their hinge pattern.
Yeah.
And if they don't know how to hinge, that you got to start with motor control. But if you're starting with motor control, you can still do those plank variations, those bridge, and those hip press variations. That way they're still getting strong in the lower quadrant of their posterior chain, but you're not loading the pattern in a way that they're going to hurt themselves. And then once somebody can start to get up to weight, you still work those stability interventions, especially if somebody doesn't have the bracing pattern, but you just start lighter with some of those earlier variations. So the higher on this list and on this list, the easier it is to do the exercise, if that makes sense. And then same thing with the motor control ones. If somebody can do these patterns, or I'm sorry, if somebody needs to learn how to do these patterns, the earlier ones on these lists are the easier ones. So bridge all the way up through to full barbell deadlift would be the hardest, with like a hip bridge on the floor being the easiest. So just from a programming aspect, you can keep that in mind. And then with some folks too, like you can use some of these earlier variations to make it as a corrective exercise or move prep. Like that, Dave, that's what we went over a couple weeks ago. Cool. All right, fellas. Well, I think we're going to run out of time here quick, but if you guys have any questions, feel free to let me know. I'm going to find a way to compress this video and send it to you, and I will send you the slides as well, so you guys will have those to reference in the future too.